Kids get ready to head back to school. Parents across Maryland are double checking their school supply list, right? You got to do all that and their schedules and also your vaccine records.
A lot to do, and we are so close.
Yeah.
Right there. Earlier this week, though, we told you about the American Academy of Pediatrics countering the CDC's stance on COVID shots for kids. And well, some of you may be a little bit confused by the different recommendations.
Yeah, joining us now to provide some clarity on all this is Dr. Monique Swallow-Burke.
Great.
I got it right, from the American Academy of Pediatrics. So, Doctor, thank you so much for being with us.
Thanks so much. I appreciate you having me. This is so important, and it's a great time to talk about vaccines.
It really is. Considering that and considering this news here, what recommendations do you give to parents to navigate all of this?
So it is really difficult, and as we said, going back to school, we've got our backpacks and our pencils and all of our school supplies, and vaccines are really another tool we have in our toolkit to make sure that our kids stay healthy and safe so that they can learn easily. In addition to having morbidity and mortality from these, vaccine preventable diseases, we also have children that can miss schools, days of school, which also can really affect learning. I do know that with the new recommendations the AAP had put out, they're not new. I always want people to remember that the AAP has been making recommendations for almost 95 years, right? Since the 1930s, we've been putting out recommendations for vaccines. So it's trusted, it's based on science, and we're really lucky here in Maryland because some of the scientists who provide the data for these recommendations live right here in Maryland.
Wow.
Okay, and are you seeing any specific trends with vaccinations in Maryland right now?
I think parents are concerned and they want to ask the right questions. And as I say, as a parent, we always want to do what's best for our children. That's really where we're basing it from. The AAP recommendations are based on science and really promoting child health. So I think for parents, it's important to ask those trusted healthcare providers to make those connections with your pediatrician and really follow that advice that makes you feel comfortable from someone who is trusted and really part of your family.
And as you said, parents really just want to do, for the most part, they just want to do what's best for their kids.
Right.
What advice would you give for, a family that's on the fence? What is the advice that you would say to first keep in mind?
So, I always tell patients that, first of all, I'm a parent. We all have many, many titles in our life, and my most important one is mom. I don't recommend anything for your children that I don't recommend for mine. So just remembering that vaccines are safe, the science is well tested. And like I said, here in the state of Maryland, we're so lucky to have many of these providers who are providing this information and reviewing this data for us. I feel safe, I feel comfortable, and I feel confident that vaccinating your child is the right thing to do to prevent these diseases that could really have a significant impact on their life.
So, the Centers for Disease Control, they're an organization, right, in the government here. What do you tell people who say, well, which one do I follow? I know you're talking AAP, but they also have this list over here now. The balancing act is just really hard.
It's really difficult. And the reason I tell parents, the reason that the AAP, once again, we've published this for over 90 years. It's important. In the past, we've always worked in conjunction with CDC, but with concerns about the dismissal of some of the scientists who review the data, we felt that it was really important to make sure that we continued to provide safe, sound, and scientifically based advice, and that's what we're really doing.
What should parents do if their child has fallen behind on vaccinations as we get ready for the school year here?
So, I think it depends. Obviously, the first choice is to call your pediatrician or your pediatric healthcare provider. We always are going to make that a priority to get you in for your vaccines. Secondly, you can also check with your local health department if you're having concerns and you feel like you want to make sure that they're up to date. You can go online and you can review the immunization requirements for your county school. And also, even some of the counties will have local vaccine back to school drives, so you can check with your local county health department.
And I have a question for you. I'm on this mom Facebook group,
Yes.
and there were some parents who were saying, wait, is there a new requirement for a certain vaccine? I think some moms were a little confused about the requirements for school, but I don't think there are any new ones on the list, correct?
Nope,
Okay.
the same vaccine schedule that we've been using in the state of Maryland for a very long time. So the recommended vaccination schedule has not changed.
Okay.
And the state of Maryland will continue to support the AAP's recommendation schedule as well.
All right.
All right, Dr. Swallow,
Yeah.
thank you so much.
Thanks so much. Thanks
Always
for
a
having
pleasure
me.
to have you.
All right, you guys, happy back to school.
Happy back to
for
school.
sure. I can't believe it.
And you're going to be busy, I'm sure.
Absolutely.
Right. Well, we do have links to Maryland school vaccine requirements and information about clinics county by county. It's all in our back to school guide. You can find that in the WBAL TV app.